For this health check, we're focusing on something that touches nearly every family in our community, heart health. Joining me in studio tonight to tell us more about risk factors and awareness associated with heart health is cardiologist Dr. David Gnegy with WVU Medicine Camden Clark. Dr. Gnegy, thank you so much for sitting down with me.
It's a pleasure to be here, Andrew.
Of course, thank you so much. So the first thing that I want to ask you is, in our community specifically, there's a huge focus on heart health. Why?
Well, being in West Virginia, based upon our demographics, the food deserts that we live in, our unhealthy population, heart disease is prevalent. The prevalence of heart disease in West Virginia is almost twice of that in the United States. Wow. It's astonishing. So as you said, a lot of families are touched by this. And 21% of the deaths in this state are based upon heart disease. We have a sedentary population. Unfortunately, we're one of the, I think recently we earned the distinct honor of being the obesest state in the United States. So those risk factors plus smoking really drive a lot of the coronary disease in our region.
Absolutely, and you talk about some of those risk factors, smoking and some other things. Yeah. What about age, family history, and lifestyle choice? Can you talk about some of the things that maybe are bad for your heart health?
So let's talk about family history. We can't choose our parents.
Absolutely.
So genetics play a very strong role. So what we have to do, if we have a strong family history of coronary disease, we have to do the things that lessen that risk, and those are the modifiable risk factors. Smoking. Smoking increases our risk of heart disease greatly.
Right.
So it's very important not start smoking, and if you do smoke, to stop. And you know, we're seeing a lot more teenagers and young adults smoke and vaping. So that's not a good thing. Physical activity. The recommendation is 150 minutes a week.
Right.
30 minutes at least 5 days a week of getting some moderate level of exercise where you're doing something cardio, where you're getting your heart rate up. Even if that's going for a walk in the park. Moving is better than not moving.
Right,
and
absolutely.
I tell my patients that all the time. They're like, well, I can't do that. Start walking to the end of the driveway.
Even just getting your mail.
Yeah, then next day a little further. And it's amazing what it'll do for your physical well-being, not to mention your mental well-being. Healthy eating. Sometimes it's hard, especially on a limited budget. And in the state of West Virginia, we have a lot of people that have a limited income. And for whatever reason, ultra-processed foods are cheaper than getting fresh vegetables and fresh fruit. But starting at an early time in life, learn as you're a kid, fresh vegetables, fresh fruit, lean meats, and beef is, I mean, you know, people say I can't do without my steak, and you know, I'm not going to make anyone not eat their steak, but you know, trim the fat off lean, limit the amount, portion control, and being a healthy eater. And then being a healthy eater, exercise helps with this obesity epidemic that we have in the United States, and worse so in West Virginia.
Right, and so I want to turn our attention now to some of the warning signs, the symptoms that people may start to see, and things that they shouldn't ignore and go see a doctor over their heart health. Can you kind of give us some insight on that?
So, the classic is chest discomfort. We sometimes use the word pain, chest pain, and people say, I don't have chest pain. It's just that squeezing sensation. So, anything in your chest that isn't right, squeezing, tightness, sharpness, radiates through the shoulder, the jaw, the back of the neck, shortness of breath, sweating, an upset stomach with that. Those are sort of the classic examples. Can occur at rest or with exertion. Women, they don't follow the rules necessarily when it comes to this. So even very vague symptoms in women of I just don't feel right. I'm more tired. My back hurts.
Right.
They need to pay attention to those symptoms too. Because of the vague symptoms that women can have, lots of times they present late with their heart disease, which leads to poorer outcomes for women versus men.
Right. And so the final question I want to ask you before I let you go tonight is talking about the numbers, knowing your numbers, like your cholesterol level, blood sugar. Why are those things so important for people that deal with heart health issues?
So we know that cholesterol leads to building up plaques in the arteries. And you know, we all know the 200 number for cholesterol, below 200. We get deeper into it. There's good cholesterol and bad cholesterol, LDLs and HDLs. We like to see our LDLs, if you have heart disease, below 70, and in some folks below 55.
Right.
Lower is better there. HDLs, which is the good cholesterol, higher. Exercise can help the HDLs get higher. To get your LDLs low like that, lots of times requires medications.
Right.
We also look at lipo(a) as an increased risk for heart disease. No treatment for that as of yet, but it's in the pipeline. Hemoglobin A1C, that's in the diabetics. We like to see that less than 7 because having diabetes increases your risk of developing coronary disease greatly. Blood pressure. We like to see blood pressure less than, ideally, 120 over 80. 130 or above, we're going to start treatment, especially with the new guidelines that's came out. Healthy eating, exercise, and everything helps with all those numbers as well. But lots of times we do have to use medications.
All right, well, Dr. Gnegy, thank you so much for sharing your wealth of knowledge with us about heart health. And we'll have you on again next week to talk a little bit more about heart health, some of the advancements in technology, and also talking about, you know, how to prevent people from dealing with things like this. So thank you very much for sitting down with us.
Very good. Looking forward to it.
Thank you so much. When we return Mid-Ohio Valley, we'll have one last look at your forecast. Stay with us.